What is the length of this meeting?
Usually about an hour, but a lot less. It will be less. Okay, let me see if we get back to this. Okay, welcome everybody to the Older Vermonters Caucus. Thank you for being here today. Getting a little feedback out there. I think we can fix that. So thanks for being here today. I just have a quick report from the legislature yesterday, a bill that we've talked about in the caucus a number of times, H 721, which is the Medicaid savings program, increasing the eligibility to that program to really help low-income Vermonters, especially in rural Vermont, was the eligibility for that program was increased. So that should help a lot of people with access to care. And I really want to thank Mike Fisher and his staff and all the work they put into it to really get that across the finish line yesterday. It's got a long way to go, obviously, the Senate and to the governor, but it was nice to see that move. I think it's going to help quite a few people not have to make really hard decisions about access to care or how they're going to provide, with how they're going to get food. So I was glad to vote in favor of that yesterday, and we'll see where it goes from there. So we'll start with that. Does anyone else have any announcements they want to make before we get going here today? Taking a look at the screen. Anyone in the room? Anything? Yeah, go ahead, Meg.
Just remind everybody that tomorrow's Alzheimer's Advocacy Day at the State House, and we'll be at the Unitarian Church tomorrow morning starting at 10, and we'll be in front of the State House at 1:45 for a photo and on the House floor at 1 o'clock. If I know some folks on the screen are already joining us, thank you. But if anybody else wants to show up or is there, we'd love to have you join our photo or stand with us in the House chamber as we're recognized. And thank you, Representative Noyes, for all your help in pulling this together and for recognizing us when we are in the House chamber.
Yeah, no problem. And thank you for making it all happen and doing all the heavy lifting and all the hard work. I'm just like, okay, we want to do this on this day. So thank you. Definitely important to raise awareness in the work that you're doing and to really keep that in front of my colleagues over there. So thanks. All right. Anything else anyone wants to bring up before we get started here? Today we have Beth Stern from Senator Sanders' office.
I can make a quick announcement.
Yeah, of course.
At the Montpelier Senior Activity Center, we're beginning to serve congregate lunches weekly, and that will start April 4th. So come by anytime. All ages are welcome. At noon, we serve a buffet meal, and I'd love to see some of you there in the future.
Awesome. What's the name of the building?
Montpelier Senior Activity Center, 58 Berry Street. It looks like Mary Alice's.
Yeah.
Thank you.
Good. Thank you.
You're welcome.
Mary Alice.
Yes, I can't see you, but I want to mention the single payer universal health care caucus meeting tonight at 5 o'clock at the State House cafeteria. Come at 5 for socializing. The meeting starts at 5:30. It's going to talk about Act 48 and universal health care and perhaps a state-based new version.
Okay. Thanks for letting people know about that. I think you'll have a lot of people in the building at 5 o'clock. I think we'll be there till 10. So thanks. All right. So I'll turn it over to Beth. Thank you for being here today. And Beth Stern works for Senator Sanders, and we're really glad she's here to talk about what the senator's been working on, and especially around the reauthorization of the Older Americans Act. So really appreciate you coming today and being with us. Thank you.
Yeah, thanks. Can everybody hear me okay?
Mm-hmm.
All right. So first of all, before I get into the Older Americans Act, just want to let people know about an event tomorrow at the Waterbury Senior Center at 11:30. The senator will be there. He wants to have a discussion with older Vermonters about the Older Americans Act and what things should be changed. So if you can make it, that would be wonderful. He'll be taking, questions and just having a discussion to hear from hear from folks out in the field. So if you do know that you're gonna make it, just feel free to send me an email and I can stick my email in the chat when I'm done here. So regarding the Older Americans Act, as you know, it's up for reauthorization this year. It expires September 30th of this year. Senator Sanders is chair of the Health Committee, which is Health, Education, Labor, and Pensions, and that committee is tasked with leading the work to reauthorize the law. He held a hearing in the Health Committee on March 7th around this issue. And the committee's also been soliciting ideas from the field about what Congress should consider for reauthorization. That input is on that level is officially closed, but I know some of you did send input, so thank you for that. Also, I can forward any notes or questions that we get today to the committee, to the help staff, so it's not too late to give input. So Senator Sanders believes we have a moral obligation to support people to age with dignity, maintain their health and well-being. He knows that the Older Americans Act is very effective at addressing the needs of older Vermonters and older adults, including helping people live at home, have access to healthy foods and transportation and protection from abuse. He also knows it's extremely cost effective, but despite the law's successes, it has been inadequately funded for years. Since 2016, despite increased demand and a massive increase in the number of older people in America, funding for the Older Americans Act has gone down by nearly 20% after adjusting for inflation and population growth. He also knows that the COVID-19 pandemic had a tremendous impact on older Americans. It both exacerbated the challenges and it also demonstrated the value of Older Americans Act programs for older adults. As part of the CARES Act, Congress granted flexibilities to assist organizations in adjusting their operations throughout the pandemic. And the committee is interested to see how pandemic area flexibilities, particularly with meals programs, worked or did not work in responding to the needs of older adults, and how or if those should be continued outside the public emergency. So thinking, for example, grab and go meals that most of the senior centers pivoted to during the peak of the pandemic. The committee is also interested in how changing demographics should inform them in the Older Americans Act reauthorization. So in the senator's view, it's our responsibility not to simply reauthorize this legislation and maintain the status quo. It's our responsibility to expand the Older Americans Act so that every older adult can receive the services they need. The reauthorization and the funding are kind of separate things, but he, routinely and this last year called for doubling of the funding for the Older Americans Act, and he will continue to do so and to really work for that. And he'll also be working with his colleagues over the next few months to consider the priorities from the Aging Network and work to develop legislation to reauthorize the Older Americans Act. So that's kind of where it's at. I got a few other notes here. Hold on. Yeah. No, I guess that's it. That's it for my notes. So I'm glad to answer questions as much as I can or take notes about people's priorities and send that on to the Help Committee. Whatever you think is best.
Great, thank you. We're really glad that we have Senator Sanders advocating, and especially as the chair of that committee. Is pretty amazing to be a very small state with someone who's really kind of steering that whole discussion. So that's definitely a good thing for Vermont. So, all right, I see Steve's got his hand up.
Thank you very much, Representative Noyes, and thank you, Beth. And as always, profound thanks to our now senior senator for his continuing work on behalf of the least among us. Are there any plans in his committee to how do I put this gently, to outlaw and kick the shit out of Medicare Advantage programs?
Good question. Thank you. I love your framing of that. So unfortunately, the Health Committee does not regulate Medicare. That is under the Finance Committee. So I would say, no, there's no plans under his committee to kick the shit out of Medicare Advantage plans. He is not a Medicare Advantage fan. He wants to strengthen traditional Medicare to include dental, vision, and hearing, which would go a long way to evening out the inequities between Medicare Advantage and traditional Medicare. But the Health Committee, despite the health part of the name, does not regulate Medicare.
Got it. Thank you very much.
Yep.
All right, Mary Alice.
Yes, Beth. I would like to know if the senator has signed on for the state-based Universal Health Care Act, which is being introduced by Senator Markey from Massachusetts within the next few days. I know it's in his committee under Help, but I just wondered if he has actually signed on to that bill.
I don't know
Which
the
I
answer.
know is-
Yeah, I don't know the answer to that, Mary Alice, and but I can ask and get back to you. It's called the State-Based Universal Healthcare Act.
Yes, I don't know the number, but I have been told that we need to get to our senators, and I did leave a message with the senator at the, online.
Okay. Yeah, I'm not as, yeah, I don't know the answer, but I'll find out.
Thank you.
Yeah.
Deanna.
Thank you. I'm just wondering, and would love to hear thoughts about, we've heard that Congress passed an $8 million funding cut for Meals on Wheels over the weekend. And as a Meals on Wheels provider, that's really concerning. Can you speak to that at all?
Yeah, I sent the figures to Dan, and Dan, I don't know if you have the ability to put them in the chat. The
I'm
cut,
gonna try.
yeah, if not, I can do it later. I can't, it's
Do it.
I'm not really very good at multitasking when I'm online like this, so like
You're
some
good.
people can.
I'll figure it out. I'll get
Some
it.
people can like go and get a document and put it in the chat. And I just like, I gotta focus on one thing at a time. The cut from what I could tell was under the NSIP program, not Meals on Wheels. Particularly, so there's congregate meals, Meals on Wheels, and then there's NSIP, which is Nutrition Supplemental Incentive Program. I'm not 100% sure, and I'm a little bit too far out of my time with area agencies to know exactly what that's used for, but it wasn't under the Meals on Wheels title. It was under NSIP. It is still a cut, but the other two Meals on Wheels and congregate meals went up. NSIP was the only one that went down.
Okay, I just put it in the chat so you can see some of the numbers that Beth sent over earlier. And you can see that the congregate meals is up 25 million, home delivered meals up 15 million. And I think the 8 that you saw in that press release, Deanna, that I saw also, is from the difference between that and the decrease in the nutrition service incentive program, which works out to about 8 million overall.
Okay, that's interesting and helpful. Thank you. We used to get a specific, it was cents, not dollars even, but cents that was attributed to NSIP, but that was eliminated quite a long time ago. So I'm not sure if it's just rolled into what we get for reimbursement, but
Yeah,
helpful-
something you
helpful starting point.
probably should touch base with the state on. I see Jason's on the call, so I think that would be something to talk with them about. Because again, I'm not remembering clearly exactly how the NSIP numbers came and how much they figured into this, but I can say that home delivered meals and congregate meals, those particular titles saw an increase, not a decrease. That said, the senator still thinks it's not enough and wants to continue to increase the funding for all the Older Americans Act program dramatically. And that's a big priority of his.
Which is actually working out in our advantage because they're going to have this discussion again and looking at the this particular budget change, may be helpful in making the case that we need to really include increases across the board. So
Yeah, and just remember, the reauthorization is not the budget. So the reauthorization is the programs and the services and the explanation of what can be funded under certain things and adding things as priorities, like when National Caregiver was added, I don't know, 15, 20 years ago. So they can make recommendations, but the budget is separate and the appropriations is separate. So the authorization won't say you have to fund this act at X amount. They could include something that says we encourage the appropriators to double the funding or to do whatever, and those letters go in. But it's something I had to kind of grapple with, in my past work, is that the reauthorization doesn't mean any automatic increases or decreases, but it's more along the programmatic side.
Thank you. I think, and you've heard me say before, we're really concerned about capacity building and being able to serve the growing number of older adults that we're seeing, and wanting to make sure that somehow funding makes it to senior centers and meal providers. Right now, the primary way that we receive any funding is really only related to meals, and then some small amounts for some places related to transportation. And it would be really wonderful if there was a way to ensure in the Older Americans Act that other programs, evidence-based programs and other types of funding for running senior centers makes it to us.
Yep. Yeah, we've definitely heard that input. So thank you for that.
Thank you.
Brett?
Yeah, Beth, just a quick question. Will the Waterbury event tomorrow be in person only, or is there any opportunity for a Zoom participation?
In person only.
Okay, thank you.
Yeah, sorry about that.
One more question about that event in Waterbury is, you mentioned when you started, he wants to hear from older Vermonters. Does he also want providers to be there, or is this really focused on older Vermonters?
Providers are obviously welcome. I think his focus is on people who are getting services. And so, if he had to prioritize who he was going to ask questions of, it would be people getting services. But again, everybody's welcome. He feels like he can talk to providers, and he does talk to providers, in other ways, but he doesn't often get to hear from the people who are receiving services or who need services.
Okay, thank you.
All right. Any questions in the room here all right? Yeah,
Pardon
Yeah,
me.
go ahead.
Actually, I have a comment. I think I tracked down that one bill that Mary was talking about. Looks like HR 6270. It's in the House, though, not the Senate. Becca Balance signed on to that one. So maybe it'll be able to switch over.
Yeah, Mary Alice?
I just want to say, I know it's in the House now, but they're also, Senator Markey is planning to introduce it in the Senate, and he needs all the supporters he can get on to sign on to it. It's a state-based bill. It means that Vermont or Oregon or California, some of the states that have been working on state-based universal health care systems could go. And it's been noted that the President Biden is in favor of state-based to go on, like Canada started universal health care in one of the provinces.
Okay, what I can do, since it's not in the Senate yet, and thank you, whoever it was who looked that up. I really appreciate that. Is I will flag it for the health team. If it's not over there yet, obviously he hasn't signed on to it, but I'll flag it, and when it comes over, they'll take a look at it. And sometimes it's really interesting the way sign-ons happen sometimes. It's and I don't know if this happens with every bill, but there's this thing where you often have to get like equal Republicans and Democrats. So sometimes the senator, well, a couple things I'll say. You know, if they're trying to do it equally like that, they may not allow people to sign on immediately until they get people from the other party. The other thing, if it's in his committee, if the bill is going through his committee, he often does not sign on to those bills because he is the chair, and that would kind of unduly influence things. So I always tell people, just because he doesn't sign on to something doesn't mean he doesn't like it. That's a lot of negatives. Basically, there are often bills that he likes that he doesn't sign on to for a variety of reasons. So nobody should take that as disapproval.
That's a good point. It happens all the time within here at the state level as well, where a chair will be definitely in favor, but not sign on to a bill.
Right, because they're the chair, it's a little bit of a different position, and he rarely signs on as chair for bills that come before his committee.
Along with the speaker, she won't sign on to any bills either.
Yeah, but as you know his opinion of universal health care, so I think you could safely say he'd be in favor of it. The other thing I will just say right now is that, you know, all of you, and I know most of you on this call, all of you pay attention to what's going on in DC. I know that. And you all know what a disaster it is right now, essentially, and how hard it is to pass anything. And, you know, case in point, took 6 months to pass budgets. So I don't know, especially given the election coming up, that we're expecting a lot to move through Congress in the next few months. There are some priorities like the Older Americans Act and other things that, you know, need to get reauthorized, but any kind of bill that might have a hint of controversy about it, and even bills that aren't getting put up for a vote. And part of that is that, you know, you have to have 60 votes in the Senate to get it to a vote, and the Republicans are just blocking everything. So it doesn't really matter whether they like it or not, they're just blocking it. And then the House is a whole nother story. So that's a pretty negative view of DC, but it is really challenging right now to get anything through.
Yeah, and I know Deanna touched on the senior centers and the importance they have in Vermont as a place for people to get access to services, a meal, kind of an anchor in the community for them. And just I'm glad that there is some discussion, I understand, in the Older Americans Act about what does that look like moving forward, and just really want to think about rural Vermont. And I know the senator will think about this, that the inequities from more urban areas where there's a lot more resources versus when you get up to like Gilman and these very small senior centers, just to really think about the fact that you know, we need to figure out how to support equally or equitably across our state. So, and I'm sure our country. So, you know, we think about the rurality of where our older Vermonters, we had, what was his name from 7 Days was here a couple of weeks ago. And it really was like rural Vermont that had the higher population of older Vermonters. So just thinking about how we make sure we distribute those funds equitably across our state. So.
Yeah, no, absolutely. And also, how do we look at making senior centers and the Older Americans Act services responsive to the changing demographics? You know, there are a lot of older people in Vermont, but you know, the biggest wave is going to be the younger people coming into being seniors. And how do we make these services attractive? Make people want to go to the classes, to the meals, to whatever. I know, Deanna, you've done a lot of work with that. So I think that's been part of the discussions for sure.
And we talked a lot about that during Age Strong Vermont when we were working on our 10-year plan. Really about how we engage the next generation of individuals that we need to make sure they don't fall through the cracks for sure.
Yeah. The other thing I just wanted to put a plug in for is our congressionally directed spending opportunity. So that's CDS, or otherwise known as earmarks. Senator, with the final approval of the budget this year, the last of the fiscal year 24 CDS projects were approved. Unfortunately, none of them were specific to older Vermonters, though, it's a long process, which I won't get into, but it's kind of challenging. But anyway, there is an opportunity to apply again. Deadline is April 8th. Information's on the website, or you can reach out to me if you have questions about that. But, he is very interested in anything to do with nutrition, anything to do with older Vermonters, anything to do with healthcare, access, all of those things.
Hang on.
Childcare savings.
Bear with me 1 second.
The $10 million is the FY24. We could.
I gotta find your, Peter, I gotta find your, thing here. We can hear what's going on. Oh, he got it. Okay, cool. All right, I think I saw Breck's hand first and then Mary.
Yeah, Beth, I just had a question of you. Last week we heard from State Treasurer Piacek about about a variety of things, but one of the things he mentioned was contracting. It was about housing. He spoke a bit about housing and the possibility of contracting with a company or companies in Vermont that would produce modular units, a large number of modular units that could then be deployed, 5 of them over here, 3 of them over there, 10 of them over here, and might be connected to, developing senior center supports and so forth. Is there anything in the Older American Act that would help to support that sort of model?
I don't know. That's a really good question. I don't know if there's anything particularly in the Older Americans Act at this point along those lines, but I may be wrong. I'm also just thinking whether there's an opportunity with the earmarks to do something along those lines, and there may be. So certainly worth exploring. But it's a great idea.
Who would we explore that with?
So it was housing. Who was the initial person you talked about?
Oh, Treasurer Piacek.
Oh, okay. Who would be the applicant? Who would actually do it? The state?
This was just an idea that was put forward, which so I'm not sure who would be the right person to put it forward. I presume the state, but could it be another organization?
It could be a housing organization. The state is eligible to apply for the earmarks as well, so they could do it. It can't be like sub-granted out to people, and money can't go to like for-profit organizations. So if the money was going to go to, a builder of modular homes and they're for-profit, that's not going to work. So yeah, I'm glad, if you want to send me an email, I'm glad to look at it and kind of confer with my housing staff colleague. Hard to say. I don't really know.
Thank you.
Yeah.
Hey, Mary.
Thank you. I apologize. I'm leaving my video off today because I'm traveling. So, but I did want to just mention when it comes to the Older Americans Act that something that we don't always talk about, and I think it's just really critical to underscore it, that the very really underpinnings of the Older American Act are that we as area agencies on aging and the community organizations we fund are serving those in the most social and economic need. And that is a major philosophical, well, not just philosophical underpinning of the act, but an operational one as well. And I see more and more, and we're hearing in our assessment work, more and more Vermonters and older adults are extremely concerned about affordability, financial affordability. How will I afford my retirement? I may hopefully live longer because we're healthier and living longer. How am I going to afford that? And how will I afford my health care? And so Medicare is not part of this discussion, but that is a big concern for people. And sometimes we don't always recognize that in the OAA. And I do want to underscore it as the need just keeps growing.
Thank you, Mary. I mean, again, you're right, it's not under the OAA, but the senator has introduced a bill to lift the cap on Social Security contributions, which would increase the amount people get under Social Security and fully fund the program for the next 75 years. You know, he's also done a lot of work on healthcare expenses, including lowering the cost of some individual healthcare expenses like insulin and a few other things, you know, and very aware of the challenges of the cost of healthcare. Yeah, thank you.
Thank you, Beth, and thank you to the senator for that. And
yeah,
again, I was distinguishing Medicare issues, and we do have some initiatives at the state level to address that as well, which are still alive at this stage in the session, which is wonderful news. But you know, just to underscore that the OAA is also about serving those in the most economic and social need.
Right, and that's important to remember. I mean, the Older Americans Act services are not means tested, so and you know, everybody knows that you can go in and get a meal and not have to disclose your income, but the focus of the outreach is supposed to be towards people who are, as Mary said, the more vulnerable folks. Although services are open, you know, to anyone over 60, anyone over 60.
Great, thanks for that point, Mary, for sure. All right, anyone else have anything they'd like to discuss today? All right, we've got some interesting legislation on the floor today. It's going to be there for quite a while, as I was saying earlier. We've got a housing bill that makes some pretty serious investments to housing, which is often a common topic when we're talking about the needs of older Vermonters, especially in rural Vermont, and not really having a place to go from their house up on East Hill, not having that age-specific housing or senior housing in their community. So hopefully we see some investments in housing in rural Vermont, in our village centers and downtowns for older Vermonters. I think it would be really helpful as we see our population changing. So they just changed some of the criteria for the funding on that. It's actually coming out of the property transfer tax. It was at looking at properties over 650,000, and now it's up to 750,000. So we'll be hearing more about that today on the floor, I'm sure. So, but all right. Thank you, everybody. And thank you, Beth, for taking the time to be here today. I really appreciate it. Always good to have the ability to connect with Senator Sanders and staff like yourself. Super important for the work that we're all trying to do here. So thank you.
Yeah, appreciate your asking, and it's good to see everybody.
All right. Have a great day.